Hi friends, I'm Dr. Aparna and welcome back to my channel. Today in this lecture, we will be talking on a small topic that is oral mucosal. Let's begin. Mucocele is a common lesion of oral mucosa involving salivary glands and their ducts. The term mucocele is derived from a Latin word. We can split the term mucocele into two parts, mucus and cele. Mucus means mucus filled. Seal means cavity. In short, mucocele means mucus filled cavity. Any trauma or obstruction in the minor salivary gland duct causes accumulation of saliva and thereby swelling. This is mucocele. Let's see the definition of mucocele. Mucocele is a clinical term that describes swelling caused by the accumulation of saliva at the site of traumatized or obstructed minor salivary gland duct. On the basis of histology, mucocele can be classified into two types. The first one is mucus extravasation type and the second one is mucus retention type. The diagram clearly shows the difference between the two types of mucocele. If we see the diagram of extravasation type of mucocele, we can see that due to some trauma, the minor salivary gland duct got ruptured and there is pooling of saliva in the adjacent submucosal tissue. As a result of this, there is inflammation and consequent swelling. If you observe the diagram of retention mucocele, it is evident that due to obstruction of minor salivary gland duct, there is blockage of saliva and there is accumulation of saliva and dilation of the duct. Let's see in detail about both types of mucocele. Extravasation mucocele. It is a pseudocyst. That means there is no epithelial lining. It is more common and formed as a result of trauma to minor salivary gland excretory duct. Laceration of the duct results in pooling of the saliva in the adjacent submucosal tissue and consequent swelling. It is most frequently occur on the lower lip where trauma is common. The other sites are buccal mucosa, tongue, floor of the mouth and retromolar region. It usually affects children and young adults. Retention mucocele. It is a true cyst because it has epithelial lining. It is least common, formed as a result of obstruction of minor salivary gland duct, often by a xylolith, periductal scarring or tumor. The blockage of salivary flow results in the accumulation of saliva and dilation of the duct. It is more commonly found on the upper lip, palate, buccal mucosa, floor of the mouth and rarely on the lower lip. It usually affects older individuals. Ductal narrowing associated with mucus retention cysts has also been associated with frequent use of hydrogen peroxide as mouth rinse and tartar control toothpaste. Clinical features. Clinical features of both types of mucocele is same apart from the site of occurrence. In the previous slide, we have seen that extravasation mucocele is most frequently seen on lower lip. The other sites are buccal mucosa, tongue, floor of the mouth and retromolar region. Retention mucocele is found mostly on upper lip. The other sites are buccal mucosa, floor of the mouth and rarely on lower lip. Mucocele often present as discrete, painless, smooth surface swellings that range from a few millimeters to a few centimeters in diameter. Superficial lesions have a characteristic blue hue. Deeper lesion can be more diffuse, covered by normal appearing mucosa without distinct blue color. Mucocele that continue to be traumatized are most likely to recur and develop surface ulceration. So, mucocele is often present as discrete, painless, smooth surface swelling, and the size range from few millimeters to few centimeters. The superficial type of mucocele will be blue hue, and deeper lesion will not have blue hue. The mucoceles which undergo continuous traumatization may recur and they develop surface ulceration. Histopathologic features. In retention mucocele, there is cis lining present and it may be variable. It may consist of cuboidal, columnar or atrophic squamous epithelium surrounding a small cystic cavity that contains thick mucoid secretion at its center. That means at the center, mucin is present and surrounding that there may be variable type of cells. It may be at cuboidal, columnar, or atrophic squamous epithelium. In extravasation mucocele, cystic lining is absent. It shows area of spilled mucin surrounded by compressed connective tissue wall or granulation tissue. The adjacent connective tissue shows numerous inflammatory cells which include macrophages, neutrophils, eosinophils, and lymphocytes. The feeding duct from an adjacent salivary gland might be seen draining within the mucus filled cavity. In extravasation mucocele, we can see that the adjacent submucosal tissue contains inflammatory cells including macrophages, neutrophils, eosinophils, and lymphocytes. Cystic lining is absent in extravasation mucocele. Treatment. Conventional definitive surgical treatment of mucocele involves removal of the entire lesion along with the feeder salivary glands and duct. Incomplete removal of the mucocele may result in recurrence. Surgical management can be challenging since it can cause trauma to adjacent minor salivary glands and lead to development of new mucocele. The alternative treatments are electrosurgery, cryosurgery using liquid nitrogen, laser surgery, micromarsupialization, intralesional injection of corticosteroids, and sclerotherapy. So the treatment of mucocele consists of conventional definitive surgical treatment in that it involves the removal of entire lesion along with the feeder salivary gland and duct. If there is incomplete removal of the mucocele, it can result in recurrence. And any trauma during the surgical procedures causes trauma to the adjacent minor salivary glands and again it can lead to new mucocele development. The alternative treatments for mucocele are electrosurgery, cryosurgery using liquid nitrogen, laser surgery, intralesional injection of corticosteroids, and sclerotherapy. In this video, we have discussed in detail about oral mucocele. Please do subscribe to my channel and click on the bell icon so that you will be notified when I upload new videos. Thank you.